Yeah.
Right. First of all, I apologize if I pronounce your names wrong. Forgive me. I'm old. Anyway, welcome to Black Voice Hertfordshire Community Meeting. Our speakers today are Mercy Bwomono, introducing CDA Herts, Priya Vaithilingam, and Natasha Austin, Healthwatch Hertfordshire, Disparity Research Updates and Next Steps. Clive Henry, Afrophobia, Understanding Its Evidence. To find out more about Black Voice Hertfordshire community meetings, Black Voice lecturers, donation, information and services provided, please visit our Facebook page or email blackvoicelecturers@gmail.com. House rules, which are very, very important. First one, please remain muted at all times apart from when you're contributing. Please use the virtual Zoom hands up button to give notification that you'd like to contribute or write your question, comment in the chat box. Due to the specific nature of this space, please refrain from using any or all known and unknown ethnic group acronyms and words. And one of those is BAME, my pet hate. Please wait for the contribution to end before you contribute. Raised voices of the contribution is not permitted. Please do not swear or use foul language. Please place all contact information, events, projects of your organization, etc., that you wish to share in the chat. Our social platforms include Facebook, Pinterest, Snapchat, YouTube, TikTok, Instagram, and LinkedIn under the name Black Voice Lecturer, or on Twitter with the user name Black L. Our website is www.blackvoicelecturers.com. Our contact number is 07581 720032, and our email address is blackvoicelecturers@gmail.com. So I'm going to say over to you, Mercy, and I'm really, really excited. Thank you very much.
Thank you. Am I able to share my screen?
You should do. Let me just have a look past it.
Not yet, because I think I need permission, please.
Okay, that's down to Michaelia. I thought that me. Oh, that's not me. That's the host. I can't do that for you. Michaelia, can we have the share screen option, please?
Yes, all done. Yes, I managed to find it.
Thank
Yep.
you.
Oh, away you go, Mercy.
All right, thank you. No, it's still not letting me. It's saying host disabled participant screen sharing.
Okay. How is try again. Try again.
Yeah, it's working now.
Sorry. Okay.
No worries at all. Right, can everybody see that?
Yes, I can.
Okay. All right. Sorry, I'm just trying to put it on slideshow because maybe that might be better. Yeah, okay. All right, okay. Good evening, everybody. Thank you for inviting me, by the way, Michaela. It's just brilliant to be amongst like-minded people, you know, so I can share, so we can rather share experiences, learn from each other, and hopefully put, things that we've learned into some form of impactful, meaningful interventions moving forward. So I'm here to briefly introduce CDA, which stands for Community Development Action, and I'll also talk about the project that I work on. So my title is a COVID Development Officer, and I work for CDA. So I'll start off with CDA. So CDA have actually been around for over 50 years, and they deliver services and projects across Hertfordshire. Their mantra is bringing together people and communities, and they, aim to be the voice. Sorry, just a moment. I'm gonna minimize people a bit because I can't see and I would like to see. Michaela, will you let me know if people have any questions or hands up, because I've actually just minimized the whole, because it was on the screen that I couldn't see the presentation. Is that okay?
Oh yes, questions are at the end. So after everyone's presented, we're going to have a question and discussion at the end. So yeah, but I will let you know. Yes, when that is. Yes.
All right. Okay. Thank you. So CDA, as I was saying, they've been around Hertfordshire for over 50 years delivering services, and they bring people and communities together. And, they aim to be the voice and advocate for communities across Hertfordshire. As I said, they provide support, advice, and resources for voluntary organisations, and they have been nominated the Rural Community Charity for Hertfordshire. So they raise awareness from the rural community, farmers and businesses, and they also support rural housing and community halls and, just things like that. So some of the services or projects that CDA deliver include the COVID Recovery Project, which I'm going to be talking about. They also have a jobs pathway, which provides opportunities for people who are facing barriers into employment. And at the moment, they're predominantly providing that through the prison services, where we have a lady that goes in there and offers some training and works with inmates on their CVs and really try to get them work, and also people who are within the community that have not had the opportunity, to go into education or get any training. So they work with them to support them and then eventually connect them with employers. So we also have a sickle cell carers support group, and this provides a peer-to-peer support where, fellow carers that are looking after members of their family or friends that are suffering with sickle cell meet, and they, just really support one another and encourage one another. And it also just gives them a break from, their daily routines. And then we've got a community garden that's in St. Albans, and it's just a safe space for people to come work, in the garden, have a cup of tea. So really a support network for people who are going through difficult stages in their lives. It's open to the community. It's also open to other organizations. We've had schools come in there and just really do some work. We also have a play area, which is located at the Mount prison. So this provides a safe space for children when they go in with their parents to see their relatives, friends, or their dad. So it's a play area where the children can just really be children while still enjoying the company of their dads. And they also support on village halls and community buildings, as I said earlier. So if there is a village hall somewhere that is in need of some infrastructure advice and support, CDA will work with that community hall and get the right support and connect them to the various links that they need. So those are some of the projects that CDA work on. The project I work on, which I must admit I've already committed a crime, somewhere I must put a caveat somewhere, because we are actually still referring to the project as COVID Recovery Black, Asian, Minority, Ethnic Project. So you might see some of our documentation where they've actually referred to the project as COVID Recovery BAME Project. We've raised this obviously with the Board of Trustees and the Advisory Board, because at the start of the project, it gave us a lot of barriers, as you can imagine, because we are here in order to support, the ethnically diverse communities, but we are also putting them in a basket almost by using terms such as BAME. So at the moment, they haven't concluded on what's the best term to use, because as you can imagine, I don't think we will ever get the right term that will suit everybody. But having said that, they definitely need to change it from the term BAME, and they're working on it. I can't tell when they have finalized or concluded on a new name. But the project commenced in April last year and is available countrywide throughout Hertfordshire. I work with communities and organisations in East and North Hertfordshire area. With us in the West, I've got two of my colleagues. They job share, they look after all the districts in the West Herts area. So it was developed during COVID. It's part of the response to the pandemic and its disproportionate impact on the ethnic diverse communities in Hertfordshire. And we've got two aims which are very ambitious, but we've got to start somewhere because these things have been long-standing. The first is they say to address, but I always say to attempt to address inequalities, because I don't think inequalities is something that can be addressed easily. It's going to take time, but we just want to start the conversation or carry on with the conversations. So we aim to address these inequalities and improve the health and well-being of ethnic diverse individuals and communities in Hertfordshire. But we also want to encourage and support these community groups to make better links and networking within the voluntary community and social enterprises and the statutory organizations, because I'm sure you've all heard of this term hard to reach. So what we're telling them, they're not hard to reach, they are hard to engage, but you have to be persistent. You have to constantly go out there and provide the information, try and find out where these organizations are. And through this project, we've managed to identify quite a few organizations in both East and North Herts. So if we could do this in a very short period of time, how about all those organizations that have been available, because I think gone are those days where you expect service users or clients or community to come to your service. You have to take your service to them. So those are some of the two aims of the project. So we've got three key elements to the project. The first one is social prescribing. Now, I don't know if a lot of you have heard of the term social prescribing. It's been around for a couple of years now. So basically what it is a way of health professionals, health professional signposting or referring clients or service users to access services within the community, because I think they're realizing that somebody's well-being and health is not just medical. It's to do with all the other things around you, your housing, your mental health, your finances, is all connected. And some of this support, you can't really just get them from your GP, it's in the community. So part of this project, we work in partnership with primary care networks. Primary care networks are a group of GPs that are a collective, and they are called primary care networks. So we work with them, and through the primary care networks, they've got link workers and community navigators. Link workers work predominantly within the GP surgeries. Community navigators work within the community, and they also work within the hospital setting. So we are working with them so that we can facilitate an appropriate pathway for these communities that we represent, because one size doesn't fit all. I'm from Uganda. I might prefer a certain approach. It doesn't necessarily mean that someone from India will follow the same approach. So we're working with them on things like cultural appropriateness, so that they can tailor these approaches and models and frameworks to suit the people, and also promoting social prescribing. I'll come on to a bit later, but what we're finding is there's been very poor communication, because there's a lot of change coming in the health and social care. And it's not been communicated very well with the communities. I mean, even me as a professional, I struggle to understand some of the changes, the transitions. So if I'm struggling, how about someone who, doesn't have access to the resources I have? How are they going to understand that? So we're working with both the communities and organizations to try and bridge that gap. The other one is capacity building. This is something that I'm very passionate about, because I can't deliver social prescribing when people don't actually know how they're going to sustain something. This project at the moment is funded for only 2 years. So after 2 years, we will go with all our contacts, our resources, our networks. What would we have left the communities we've worked with throughout? We would have left them perhaps in some cases in perhaps even a worse off situation, because we've introduced them to something and then we've taken it away. So we're working with individuals and communities co-creatively, and using their resources, their skills, their knowledge, because they've got the network. After all, they're the ones that have been doing all the support and offering that community cohesion. So they know what is good for their own communities. So we're really just empowering them, supporting them, introducing them to networks, connecting them, so they can in turn build their own relationships, so they can carry this forward, introduce them to funding opportunities, maybe educate them on how to apply for funding. There's a case study I'll show you later how such things are important. So that's one of the biggest elements we're working on. And then of course we've got advocacy support, and we're delivering this in a partnership with Power. So basically introducing anyone that has any advocacy support needs, we introduce them to Power, and then Power can just take it on and offer that either group support or one-to-one support, so that the access to advocacy support and services within our communities is improved, or people are aware of where to go to get support. So the last point, which is enable, engage, empower, is just some of the 3 things we're trying to use to bring all those 3 elements together. We want to enable the communities, we want to engage with them, and we also want them to engage with support services, so that we don't hear such terms again, they are hard to reach. You rather bring your services to them, but more importantly, we want to empower them so they know what they can get and how to get it, and demand, for better. Those are some of the tools that we've been using to communicate. So we've got a bi-monthly newsletter that goes out. This is where we share information and updates on the project. We put upcoming events on there, funding opportunities, and if there are any other organizations that want to reach to these communities and there's a message they want to put, we put it through there. But more importantly, we use it to highlight issues. We've got a section where we highlight important issues throughout our engagement work, what is becoming a theme, what is recurring. So we use that to highlight those big things. And then we obviously attend loads of community events, such as this. Such forums is a good place for us to come share about the project, but also hear about what's happening within the community and give people an opportunity to ask us questions. And if there are any concerns, we take it. I'm glad actually the Healthwatch is on tonight, because they're one of our partners that we work with. So we collect the information, and then through the advisory board, we pass it through Healthwatch, because they've got means and ways and legal rights, to send these messages to people who are well, we should know really. And then, of course, we've got the partnership meetings. I've talked about this a bit. This is where we give direct feedback to those organizations about what people are informing us, and then work with them, not just give them the feedback, but work with them. You know, at the beginning, a lot of the issues we were getting from our engagement work is language barrier. The service is not suited to us. So we try and work with these organizations to try and see, find solutions. How can we make the service more appropriate for people? Do you need to change your opening times? You know, do you need to maybe take the support to them? Do you need to open a community hub somewhere so that people can actually come and access the support? So some of the activities that we've been doing in terms of the community engagement, I've talked about the meetings we've been attending, but we've also identified many groups. At the moment in East and North Hertfordshire, I've identified 18 community groups. So what we try to do is bring them together, you know, as part of that capacity building, because we don't have that time, you know, we don't have all the time in the world. So if I can find someone like Michaela, who's maybe gone through a funding funding application, and is willing and has the time to offer that experience to another person. So we tend to have such engagement meetings so people can share and learn from each other and support one another, because after all, when we leave, they will be left, you know, with one another. And then also we use our project to raise awareness, you know, amplify people's voices of what we've had, but we also share information and create awareness of so many, as I said earlier, health and social care changes, because there's so many things changing at the moment. So we are that source for people. We also host community events, you know, things, big events like Black History Month. We did host a very successful event. Women's Day is coming up. We're hosting events. So we always do something, you know. A big part of our role at the moment, what we're working on currently, is mental health of young people, because in our last quarterly report, which was last year, November, that was such a huge thing, but we all know, you know, mental health was on the rise already. COVID has not brought anything new. Even this health inequalities or inequalities we're talking about, these are not new things. These are long-standing things. The only reason why it's at the forefront, because COVID has just made it, everybody's more aware, you know. So if I always tell people, if there's one good thing that's come out of COVID, at least it's shown what we've been going through all this while, so everybody can see it and no one can deny that health inequalities or inequalities don't exist, you know. The other one is obviously health and social care changes. Social prescribing is one of them. The other one is the integrated care system, which is coming into transition in July. It was supposed to be in April, but it's in July. And there's been really, really poor communication on it. People are not aware. But then again, also, I've been just thinking lately that if a transition from one service to another is done seemingly well or seamlessly well, then maybe the people receiving the product, the end product, should not worry about the change. But of course, that is me living in a dream world, because we do know these things, you know, never goes smoothly. So people need to be aware of what's happening, you know. So we held an event last Thursday where we tried to bring the community together, faith leaders, voluntary organizations, with the NHS or the integrated care system, so people can have a voice, people can shape, you know, what the health and well-being is going to look like in the future, because people have already been left behind, hence why we're in this situation. So we try and encourage people to get involved, you know, because it's a two-way process, you know. We also need to buy in as a community, you know, because if we don't buy in, my opinion is we're going to be left further and further and further behind. We are not going to be invited to these tables for conversations, and they'll constantly use we don't engage. So I always encourage people that I'm aware, I know, I come from that community. We are fed up. We've been let down many times. We don't have the trust and confidence in the services, but we still have to find a way of making our voice count, and try to bridge that gap, even if it's going to take a long time, but we can't just leave it up to their hands. We were very heavily involved during summer last year in the vaccination program. So we did loads of workshops, for the community, where we invited health professionals that people can relate to. If I see somebody that looks like me, perhaps I might listen to them a bit more, and then break down the information, use the language that people understand, none of these difficult languages, and just be available to answer the questions. So we did a lot of that. And then we also helped a lot with the pop-up clinics, where it was needed, especially in my area in East Hertfordshire. Is very rural and it's really vast. And we quickly realized anyway, it wasn't hesitancy. People just didn't have access. People work, people do different shifts. So we had to change all of that. We had to change how we're delivering these pop-up clinics. If you want people to attend, you need to change certain things. We've also worked on the Afghan resettlement program. At the moment, it's supporting these communities, these people within the communities, but at the beginning, it was really offering them support in the hotels, going there to register them, doing this in partnership with Red Cross, and just trying to introduce them, to a new life, and then creating links for them, signposting them to different support services that we could not offer. So this is a case study that just illustrates some of the work we do. So this is a case study of the Bosnia and Herzegovina Community Association in Hertfordshire. At the moment, there's quite a lot of funding, that's available. So as long as people use health inequalities or inequalities, there's quite a few funding. So I always encourage organizations, please go ahead, come forward for this funding. It might not be much. And of course, I do know the difficulties they put around access to funding, and not everybody has the experience. It's very intimidating, it's challenging, but nonetheless, come forward, because there will be a time when all this money will die away, so get whatever you can out of it. Play the system, I always tell people, because sooner or later it will stop. So anyway, this case study, this group approached us because they wanted to apply for one of the funding, which is the COVID recovery funding, which was to encourage community groups to hold vaccine confidence workshops within their communities. So their challenge was they actually thought they didn't meet the criteria, they lacked the confidence, and they basically did not know what to do. It was their first funding opportunities, and they are not the only one. There's many organizations and community groups out there that all of this is new to them, because they were set up during COVID and they've done a lot of great work, So people, organizations or funders, commissioners should really acknowledge and support them, so they can carry on with that great work that we're doing. So we had to work with them, to find out what their needs were, what were they going to use the funding for, how were they going to deliver these vaccine workshops, and what were some of their barriers that they thought they could not apply for the funding. And indeed, it was putting all those papers together. So if anyone has ever applied for funding, you know how demanding and time consuming that is. So we practically did the work for them, said, open up a folder on your computer and gather all this information, the papers, because no point starting the process of filling out a form when every now and again you have to stop. So it's hand holding, really. We handheld their hands. It's time consuming, but that's our job. That's why we're here. And if we can help one organization, we would have done a lot, and then we showed them, how to apply, or talked them through it rather, how they can apply for this funding. And then just because the funding is there to say you have to use it for a COVID vaccine workshop, it doesn't necessarily mean you have to use the whole funding or time doing that. So, and with these communities, like many, I work on this COVID project. I'm tired of hearing about COVID, so you have to find a way to engage the community. So what they did, they actually had a community event. And then towards the end, they had a nurse that was just really answering questions and providing that guidance and advice to their communities. And through that way, you can still achieve what you want to do, bringing the communities together, but also deliver on a criteria of the funding, which is the COVID vaccine workshop. So they applied for it anyway, and they were successful. They hosted their event last year, but there's quite a few other organizations that we work with that, we've supported in that way. But I chose this one particularly because it highlights really some of the challenges that community groups face when they come to something as applying for funds. And most of the times people don't think of these things. They think it's a straightforward, they should know. Not everybody has that access or privilege. So working through them, their issues rather, helps them to overcome those barriers. So that's a very quick and brief introduction to CDA and to our project. I can take questions and discussions, and then if anybody just needs more information, just let me know, because I wasn't sure how long I have. But one thing that I would leave as a parting message is do connect. Do connect with projects, such as ours and others there, because it's through these projects that we are trying to create pathways or make pathways a bit easier, because it is difficult, it is challenging, and sometimes if you're doing it by yourself, it is difficult. So at least if you have a community and projects such as ours to support you, take those opportunities, and work together, share your experiences, your challenges, your learning, and let's just support one another, because sooner or later, all the support that they're providing us is going to be taken away. And we've been for years waiting for such dedicated attention, dedicated funding to us, although it's come at a very, very heavy cost and late. Nonetheless, we can still take it and use it to our benefit. So those are our details over there, my email, my number, and CDA, and I'll take any questions if there's any.
We're going to do the questions at the end, Mercy. Is that okay? And that was a brilliant discussion. Thank you. Food for thought. Well, I'm going to now move on to our colleagues from Healthwatch, Hertfordshire, Priya and Natasha. Okay, over to you.
Okay, excellent. Can you hear me?
Yes.
Yeah. Tasha, did you want me to share screen?
Oh, is that okay? Oh, Michaela, if that's okay.
Are you okay doing it, Michaela, or did you want me to
mind?
It's only because I can't get it blown up. Can you? Do you mind if you do it? Because it looks like it's written for a mouse on mine. Hang on 1 second. Go. Yeah. Okay. Yeah.
Okay. That's okay. Everyone can see it.
Yeah. Perfect.
Yeah. Okay. Excellent. Okay. Great. So it's really good to be following on from Mercy, actually, because you'll see hopefully how the project that she's just talked about in our organisation sort of complements each other quite nicely, and as Mercy's already mentioned, how we sort of look to sharing information and data and sort of playing to each other's kind of strengths. So so I myself and Tasha are here. My name is Priya, to talk to you this evening about a project that we're currently running, which is this one here called Making Local Healthcare Equal for All. And it's just to provide a bit of background to it, as well as provide some opportunities of how you might want to get involved. So some of you I recognise and will know myself and Tasha, and some of you may not. So I'll just spend a couple of minutes just introducing who Healthwatch is and who Tasha and myself are as well. So in terms of Healthwatch, so our role is to ensure that NHS and care leaders hear the patient's voice and use that feedback to improve their care. So in terms of how we're set up, we're an independent charity with statutory powers. So our independence means that we don't work for the government, we don't work for the NHS, and we don't work for local authority. But our statutory powers mean that when we make recommendations for improvement, the NHS and care leaders have a legal duty to respond. And that means that the feedback that you provide us or the information that you share with us results in making a difference, bringing about change. Although our remit solely covers Hertfordshire, we're part of a national network. So the national body is Healthwatch England. And what this means is that although, as I said, we cover Hertfordshire, if there's any kind of issues that are of national importance or issues that we feel need to be sort of escalated to a national level, we can do that through Healthwatch England. So a little bit about myself and Tasha. Tasha will obviously talk about herself. I won't do that bit. But in terms of me, so you can sort of see my background there. So I sort of studied international human rights and social research. And in terms of my work for Healthwatch, one, I was particularly attracted to the organisation because of their dedication to reducing health inequalities, improving health outcomes. And in terms of my role, I lead on that external affairs programme. And what I feel I've brought to the role is that sort of focus around, yes, addressing health inequalities through research, through the other functions that we have, but also ensuring that our work is patient-centred and ensuring that our work is always delivering like real and meaningful change. So as Mercy mentioned, in terms of delivering impact. Tasha, I'll hand over to you for you to introduce yourself and then talk a bit more about the project.
Yeah, sure. So hi, I'm Tasha. I'm a research officer at Healthwatch. My background from university is in psychology and international politics, but I did focus quite a lot on equality. And so being part of Healthwatch means I can kind of focus on achieving that in real life through the work that we do with our work on service inclusivity. So it's been a real opportunity to kind of work on something that I feel really strongly about. So what I'll do now is talk through this project, Making Local Healthcare Equal for All, that Priya's mentioned and introduced. But what it does is it focuses on hearing from Black communities about their views and experiences of local healthcare. I just want to clarify before I get into the slide, you'll see that we've got the term BAME there in inverted commas on the slide. This is because there is research on the slide, and that research, the authors of that research use that term themselves. And so we use it as a reflection of what they've said. But as an organisation, Healthwatch Hertfordshire, we don't use this term. We understand the negative implications of it. Obviously, we've had many conversations with Michaela as well. But yeah, it is just there because that's what the authors of the research used, not Healthwatch. So with that said, I'll carry on to kind of the content of the slides. So you'll probably know there's very little data, both nationally and locally, about how Black people use and experience NHS treatment. But the literature that does exist has highlighted a couple of things, showing that people generally feel that they receive unequal treatment. They don't always feel able or confident to kind of communicate and make their own decisions. They don't always feel that they're able to exercise agency or control over their bodies and their choices. And they don't always feel able to complain, or they might be reluctant to complain for fear of not being listened to. And then picking up on the first point about receiving unequal treatment, there's recent research by Clearview, which found that 78% of Black women and 47% of Black men don't believe their health is as equally protected by the NHS in comparison to that of white people. And then lastly, national research has also highlighted that satisfaction levels when using the NHS services are consistently lower in different ethnic groups compared to white British or white Irish groups. And so whilst we can identify broad themes from existing research such as these, and there are of course statistics that evidence health inequality, there is little evidence on lived experience, and that's on both a national and a local level. So our work therefore is looking to kind of build on this, obviously within Hertfordshire, with the aim being to address those gaps and highlight how Black people in Hertfordshire really feel about our local healthcare services. And then in turn, what that means is that we can support local plans for improving equality and inclusiveness in health services. If I grab the next slide, please.
Sorry, Tasha, it's frozen.
Oh, it's okay.
Okay, sorry.
Okay, yeah, it's fine. Okay, so so that we could start to understand local views on this, over the past 12 months, we've been engaging with local group leaders, so Michaela, for example, to understand what this work should look like. So as you can see from the slide, we split our research into 2 phases. So the first one, we're engaging with the public through an online survey, focus groups and one-to-one interviews. And then we're also engaging with the NHS to understand what they're currently doing to address health inequalities for Black patients and what they're doing to improve services. And so far, we've found a couple of things. So unsurprisingly, issues of trust and mistrust are multifaceted and often based on historic treatment, personal experience and community experience. Lack of engagement from individuals and communities has a lot to do with the perception of things not changing or seeing that NHS services are not built for them. And then linked to the point above, there's the feeling that there's a lack of religious and cultural sensitivity within services. And then from the NHS side of things, we were also seeing that some NHS organisations and services are performing better than others. So if I move on to consider what this kind of means for you and different communities, I'll just
Run it again.
wait for another slide.
Might just have to keep it on.
On the non-slideshow.
Yeah, sorry.
It's fine. Okay.
Yeah, sorry. I think then it'll keep moving, I think.
Okay. Okay, so as I've already mentioned, we've been working quite closely with Michaela on this project and for quite a while as well. And so Michaela, as well as us, are quite keen for people from Black Voice Letchworth and their voices to be included. So we've started to have a bit of a think about how we can facilitate this. So on the slide, you'll see that we've listed some areas that we're particularly interested in exploring, such as experiences of whether services have been equal and inclusive for you, and whether you experience any particular barriers, or maybe some people have got some good practice that they wanted to share that they think other NHS services could learn from. But really the thing to stress here is that this is an opportunity for you to talk about what matters the most to you. And so at Healthwatch, we're kind of very open to discussing anything that you think deserves a conversation. And so there are a number of ways that you can share feedback with us. So the first is to have a one-to-one discussion with us. That will provide the opportunity to share your views and experiences privately, and where you can control the information you provide and the direction of the discussion. Or people can join a focus group, so where a small number of people come together to discuss their views and experiences together. We can hold focus groups on specific topics where you can be with people who've got similar experiences, for example, mental health focus groups, or we can hold focus groups for family and friends to attend if people feel comfortable with that. But the bottom line here again is that I'm very happy to accommodate for however people feel comfortable sharing their views. And we're very open to kind of anything in that sense. But then finally, if you did want to share your views but you don't want to speak to somebody directly, then you can take part in the online survey, and we'll circulate the link as well after the meeting. It's also really important to note that if you do decide to speak to us, it's important that you feel safe and comfortable. So we've been working really closely with Michaela and also a lady called Ruhina, who's from Purple Cloud Therapy, to explore different ways that we can ensure this and kind of customize the research to fit you. So if you are interested in taking part, a really good next step would be to kind of hear from how you prefer to share your views or to engage with us, whether there are any particular services that you think we need to hear about, and if you did want to attend a focus group, how you think we could best support you to feel comfortable doing that. So we can either have those conversations here today when we have a discussion in a little bit. You can contact us or Michaela, and we can also do some meet and greet sessions if people wanted to do those, so people could kind of come along and chat to us more about the work. And then the last thing to mention here is it doesn't matter if your experience is good or if it's bad. It doesn't matter whether you're unsure if you've experienced health inequalities or not. It's still always worth sharing your story. So firstly, it's because it's important that we can hear a range of views and perspectives. But secondly, a lot of time, people might not realise whether what they've experienced is okay or not until we talk to other people and kind of shine a light on it. So that about sums it up. Thank you very much, as always, for listening. Of course, when we get around to discussion, very happy to answer any questions anyone has.
Sonia, you're on mute. You're right.
Sorry, I was just saying thank you, Tasha and Priya. And I'm going to throw the floor open now to Clive and Afrophobia, understanding its evidence. Thank you very much.
Okay, can you hear me all? Good evening all, from Nottingham, Clive Henry speaking. Just basically want to clarify what Afrophobia is. So Afrophobia is basically people of African descent experiencing widespread racism and discrimination across all areas of life, okay? And what I want to talk about is basically my experience, but an experience what is so commonplace with Black people. So just to let you know, I contacted Michaela, I think it was December, on LinkedIn. And the reason being, I am the author of this book. I'll put the book description in the links, which is a self-published autobiography, which is on Amazon. Okay, and the reason this book was released in 2020, but the reason why I decided to contact people on LinkedIn was it was December and I'm thinking, oh, it's Christmas, you know, let people have this book for free. Now, I will send you a PDF link of the book if you want to have that, and I'll put it in the chat. So yeah, I contacted Michaela and I contacted so many people, and I also did on Amazon, you can do a free download for people to take the Kindle off there for free for like 5 or 6 days. So I just let people have it, because for me, it's not about the money, it's about the information, going to people, helping people. And my experience has helped a lot of people, and I've been on Zoom calls and so many meetings so many times. So I contacted Michaela, I sent her a copy of the book, and she's read the book and she was impressed. So we've had a Zoom meeting before. But just to let you know, I mean, the reason why I wrote the book was my experiences. You know, I grew up in a family, mom and dad, 1 brother, 3 sisters. You know, I'm a child of 72, so, you know, things were a lot different then. There was no internet. It was playing out. It was, you know, a different world completely. Yeah, I grew up in a stable, good, loving family, and I had worked well. In the area where I live in Nottingham is like the inner city. So Nottingham city centre, then the surrounding areas, which is a place called St. Anne's. And, you know, over the years, it got worse, you know, with the crime and so forth. But I had a good family, so I never went down that route. And that was because of the education I had, good parents, Jamaican born parents, you know, everything's, you know, exact. And I went down the right path of getting a good education and going to work. Now, to cut a long story short, the reason why I wrote the book, I used to work for a courier service called UPS, like DHL, Parcel Force, FedEx, and I worked there for 10 years. So I went through the ranks of customer service, international customer service, like resolving parcel problems across the world. And then I did a presentation where the sales department said, oh, you're really good, I want you in our department. So I worked in the sales department, I think it was probably about 5 or 6 years. And I was really good at my job because I had the customer service experience, so I knew the product and how everything worked. And then it was a case of I think it was the 9th or the 10th year, we was basically, UPS was merging with a courier, UK courier called Lynx Couriers. And so I was asked to supervise the merge in our department. So like there's 30 people working, and it's a lot of work. You know, you got probably 40,000 accounts what need to be merged into the UPS system. So I did that for about 6 months, merging these accounts with people, and everyone's, you know, taking instructions, and we were sorting it out. Now, this project was 95% effective. So basically that was everyone merged over, apart from companies what went bust or companies what didn't want to merge with the new system. And after this, my manager got promoted. So she became really big manager across the national front. So what happened was the new manager became, my manager was the director of the company that we had taken over. This was around the time when Obama was becoming president. So it was like 2008. And the new manager managed 2 departments. So it was a high spending customer service department and the sales department. And, you know, he was the director of the company that he had. So he was very much set in his ways, very much wanted to do things his way, didn't follow the company rules. And, you know, so what happened was he started to get rid of people. And then one day I had a letter, and he wanted a meeting with me. So I had a meeting with him, and he basically put me on a thing called a performance improvement plan, which is a thing to, if someone's a low performer, to get them back on target. But what happened was this form, what he had sent me, was not signed by HR. So automatically, with me being there for so long, everything was HR approved, whether it was like new toilet paper or, you know, new pens or whatever. And I just thought it was a bit odd, but basically went on this performance improvement plan. And he set the target, which was a normal target, and I achieved the target. But then what happened next was he set a high target, which is the highest in the department ever. And we had targets, what was guidelines, but not do or die targets. When I was short of that target, he then wanted to give me disciplinary action. And that's when, you know, I realized that he's trying to force me out of a job in a legitimate kind of way. And the book highlights all this, so I know you probably remember everything I'm saying, but this is when I realized what racism in the workplace was, you know, because at this point, I'd never had a problem at work. Everything's been, you know, HR approved and equal, and there's been no problems. And I've never felt, you know, my color made any difference until this point. So they give me a written warning. He wants to give me a written, I've never had any disciplinary actions, giving me a written warning. And I just basically said, you know, we had a meeting and I said, look, I've done everything what I was supposed to do. I've supervised the merge. And he knew about this because I was at the meetings. And so he knew about it, but he was just one of them people, one of them, just imagine Donald Trump, the kind of character, he's doing his own thing. I'm doing what I want to do, forget what the company's meant to be doing. So it just became a really bad situation. And I won't go into too much details because I want you to read the book so you can see it. But it just highlighted to me that I couldn't believe that my whole life was so fragile in the workplace, because after this, it became, with what happened, it escalated to the point it became a tribunal case because they didn't want to resolve it. And it just got worse and worse and worse of what kind of tricks and bad things will happen. So it's in the book, and hopefully I can send it to you so you can read it for yourself. But, you know, within the workplace, as a Black person, you do your job and you expect to do it well and then go home to your family and live your life. And it made me realize that my whole life changed by one person and the company just saying, okay, then that person don't matter. You know, my life was, it didn't matter to them what had happened and all the effort I'd put in to make a successful merge of everything across the UK. It just really broke my spirit, you know, my lowest point. So after when I went to the tribunal and I didn't win the case, although it was a complete you know, something that you'd watch in a film. And I decided, I could not believe, I was so angry. I said, if they can do that to me, a very good worker who's been there for 10 years and like 7 years, full, like 100% attendance, accolades from customers, you know, set up massive accounts like Apple with things, and, you know, and I couldn't believe it. So I just thought to myself, you know, I looked at little kids, little black kids, and I'm thinking, if I don't speak out on this, it's something I'm going to have to live and die with, you know, forever. So I just thought to myself, I'm going to take it to another level. Now, at the time, 2009, 2010, Facebook was new, Twitter was new. I decided to contact the newspapers, and I contacted various newspapers, and I got in the Voice, which is the national black newspaper, and some other newspapers. And with those links, I decided to contact people on Twitter. Now, I thought to myself, okay, on Twitter, who's the biggest people on Twitter? You got celebrities, you've got groups, you've got people like yourselves, NHS groups. And I started to tweet out the link from The Voice with my story, what The Voice had did. And it started to grow, it started to go viral. And, you know, people like celebrities like Peter Andre retweeted it, and you could name a million people. And it just showed me, you know, that one person has got a voice, can make a difference. And from that, it went all over the planet. Now, I didn't win the case in the courts, but UPS basically wanted to take over TNT in Europe. And I had human rights groups. I had like 10 different Twitter accounts with everything you could think of, from human rights groups to celebrities to, you know, companies, NHS, you name it, I had it covered, because I thought to myself, I'm not going to let them get away with this without a fight, and also to expose the injustice, what happens in the workplace. And a lot of people contacted me and said that happened to me, or this happened to my family member, or this happened. And I couldn't believe how common it was. You know, it's like one day you go to work and the next day you get a new manager, and that manager don't like you as a black person, and you're out, and your whole life is destroyed. You know, and this leads to mental health and other things where you're never ever going to be comfortable in your own skin, because, you know, you've got this fear is there, and it's like you've got slavery. You know, a lot of people don't understand that with all that 400 years of slavery, the trauma is there in black people as standard in their DNA, from the fear of not being able to speak. You know, so I just decided, you know, I'm going to make a difference with what I've experienced. That was the basis for the book. And also to let people know you have got a voice. You know, you have got a voice. And, you know, although my book reads like a fiction, and you'll be like, you know, I'm going to put the link in the chat so you can have a quick look at the reviews. People said, you know, a lot of people have said to me, I can't believe, one, what you've gone through. Two, they said, it's opened up what racism is to me, because a lot of people just think racism is name calling. They do not understand racism is a power structure, you know, and they wasn't clear on what it is, but now a lot of people do know. And, you know, these like conversations need to happen for people to, you know, to say what they need to say. I mean, I'm a taxi driver now, and I have conversation with people, and, you know, with, like, for example, the George Floyd situation. I had a gentleman in the car, and he was like, I didn't understand this Black Lives Matter, is a white gentleman. And I was saying, look, you have to educate yourself on these things. In a 10-minute conversation in the car, we couldn't really cover much, but I said it's a long-standing thing. This George Floyd thing is not new. This has happened so many times before social media had cameras. This has been going on for hundreds of years. You know, it's just that this is now the point where social media can expose certain things, what you would never dream of seeing before. So, you know, I just, it's scary. And at the same time, it's one of those things I had to have a lot of courage. You know, when I first left my workplace, I had nothing. I basically, you imagine falling from a 20-story building, completely destroyed, and I had to rebuild my life back to a point where, you know, and finding out who your friends are, what a workplace is, what discrimination exists, and there's lots of it. in everything from, from you being unemployed, from you applying for jobs. And it's just crazy. But I just wanted to, share my experience, and hopefully people, children, adults, and, I've made the book not complicated. I wanted basically people of all ages, from children all the way up to adults. They can read it and understand it. It's not all doom and gloom. I've put in, it's my life story, so it's not all been doom and gloom, but it also will open up a lot of dialogue, a lot of conversation, and people will be able to share these things and let their family members know, because a lot of information is out there, but people don't know where to look. I've always been a nerd, even though I'm, from the inner cities. I've got the two sides to me. Whereas my parents taught me about books. When I was a kid, they didn't have Google. They had Reader's Digest encyclopedias, and I was always a curious kid. That's why I'm very good at most things. But at the same time, the determination comes from parents who came from Jamaica in the 1960s with nothing, knowing nothing, and building a life. And a lot of people, the Windrush era, they've come over. So the strength comes from that. And, reaching out to people and realizing that if you ask, people will answer, they will help you. A lot of people are scared to ask. And like people say to me on Facebook, why do you let people write what they write on your comments or whatever? I say, because everyone's got a voice, and I want people to feel comfortable. Whether I agree with them or not, you let them speak. Because I don't like people to not be able to speak, and, getting it out there, even if they're wrong. And sometimes someone might comment and they can have a communication and learn something, then that helps. But people are quick to shut people down. Don't let them speak. I'm not about that life. My mother always taught me, it's weird because my mom's not an academic. My mom and father, my dad was a fisherman in Jamaica, and my mother, she ran the shop what they had. They are not academics, but they're very wise. I love them dearly, and they taught me to be open and accept people as they are, as God made them, whatever color. I have friends all over the planet of all colors. But, I just want to thank you all for letting me share that. And I will put the link in the chat so you can have a look. And, we've all got to do our little bit. It all helps, even though you think, oh, this is really slow. But every little bit, the ripple effect of what you do, you'd be surprised. People come to you 5 years later, say, you know what, you saved my life. And I even get it in the taxi. A guy was talking to me and I gave him some positive feedback, and he goes, give me a massive tip. I goes, why are you giving me this extra tenner? He goes, you just saved my life because I was going to kill myself. And what you said, and it's moving, but at the same time you think, wow, the mental health is a big thing, and a lot of people think it's just it's just people being whatever. So yeah, it's just one of those things. But yeah, thanks for letting me share this, and I'm going to put the links in the description. And also, if you send me a blank email, I will send you a copy of the book on the panel so that you can have a read. Because like I said, it's not about money, it's about information. There might be something in there that will help you, could help your family, friends. So it's about sharing and helping my fellow man, woman. Okay, thanks a lot. I'll put it in the description now.
Right, I want to say thank you all. You all have been very inspirational, and I am humbled. So today, now I'm going to throw the floor open for questions and answers. Does anybody want to?
I've got a ton, but I'm going to let someone else go first because I always have a ton of questions.
I've got one question, okay? All right, are you all there? You can't see me. This is a question I wrote last week. This week sees a report commissioned by the NHS Race and Health Observatory. The report states that racial health inequalities are evident at every stage. Study found discrimination and poor data collection about ethnicity, and this has negatively impacted the health of BME patients. This includes a lack of appropriate treatment and discriminatory attitudes from staff. The report also warns that minority ethnic patients delay seeking help due to fear of racist treatments from NHS health professionals. So to my colleagues here from Healthwatch and Mercy, what are your opinions? Do you think there are health inequalities in the NHS?
Wasn't sure who was going to kick off in answering that one, so I think we all just stayed quiet. Shall I start and then Mercy you come in? Natasha?
Yes.
So I think that was a bit of a leading question because I feel like you've already told us that there are. But yes, definitely, there definitely are health inequalities in the NHS, and I think again what that sort of report is showing is what we already know and what sort of local evidence, national evidence is telling us. So we know that the NHS doesn't consistently and systematically collect ethnic data. We know that they don't do that, and because of not collecting that data, they're immediately unable to address certain health inequalities because they don't actually know who's using their services. So I think that, for example, I'm sure Mercy, you're doing the same thing. That's one area that we're trying to work with the NHS and are raising sort of at every level that we can to see how that can be improved. Yeah, because that's just baseline level data that you need to get in order to actually start working out what those interventions can be. You have to understand the demographics, you have to understand the patients that are using the services. Are you also doing the same thing, Mercy? I'm just thinking.
No, definitely we are. You've actually said exactly what I want to say, because yes, definitely, these inequalities exist. That's why we've got, projects such as our one. But interestingly, just before I came onto this Zoom meeting, we actually held another meeting and we were just talking amongst ourselves. It was supposed to be a dialogue between the communities and the NHS health workers or NHS officials, and not one of them showed up. Not one of them. So then we were asking, the question that why are you not present at this, conversations? Because this is an opportunity for you to actually come and start addressing these long-standing issues, these long-standing health inequalities or inequalities in general. So that's work to be picked up on Monday as to why none of them showed up, because it was a great opportunity for them to come and have that open dialogue. Yeah, but I also sometimes feel as if maybe sometimes we hide a lot behind data, data collection. And we are working with a lot of NHS professionals because one of the things that keeps coming up is that we don't know how to ask. We don't know how to really ask. We don't feel comfortable. But you have to have those conversations. They are uncomfortable, but we are living it. So how about us leaving those, moments that are really, really painful to us? And if you can't do a small thing of collecting such data, because without data, we cannot be informed of what needs to be done, what meaningful work we need to do, what interventions. I definitely agree with that report. I haven't seen it yet, but I definitely will have to see that. And then
you need to read it.
I need to read that.
Especially about maternity. And this is a question to my colleagues from the Healthwatch and yourself, Mercy. During the pandemic one, do you realise or do you know why there was 40% of BME, and I mean we shouldn't use acronyms, but this is what was in the report, why there were 40% of BMEs in intensive care? Do you know the reason why? Shall I tell you?
Yes, please.
The pulse oximeter machines do not work on black skins.
Really?
Yeah. And shall I tell you how I know?
Yes, please.
The Secretary of State for Health and Social Care told me.
That's shocking. I'm actually
40% of BME, because that was in the report, that's why I'm using it. Okay. Right, we're in hospital.
What have they done about that? That, after disclosing that?
He's commissioned a new white paper that's going to be released this year And with that, one of the recommendations is for the pulse oximeter machines to be redesigned. Did you know that, Priya and Tasha? You did, Priya.
I've read the report. Yeah.
You have read it, so thank you. So I know I'm speaking on the right track because I met the health secretary of state last week, and I'm going to use a word, and I shouldn't use it. Gobsmacked. Gobsmacked is understood.
I am. Wow. 40%.
See, Sonia, when I hear stuff like that, I don't want to touch no doctor. I'll be honest with you. This is just, I'm speaking from the ground here. This is like talking to,
Yeah.
I know you guys are doing great work. And I know that's why obviously BVL exists, because I understand that, we need to have an avenue of, okay, is change going to come? When it's going to come? We're ready for it. But I'll be honest with you, there's certain letters that you're getting right now that every woman should get a certain check. I get that letter. I ain't going there. I've got so many things to think about. One, when I go in there, the racism from the receptionist I'm gonna get. She's gonna look at me like, oh, like that. That's whole thing. Then it's quite a private examination. So it's if you get if you get somebody that knows about Black women and how we view that type of examination, not just kind of rummaging in there like, they're cleaning a toilet. So I just, the whole thing. And then when I hear this about the hot look, the people don't, when I was, it's the vaccine push, these funding stuff that they're trying to get these Black groups to kind of grab. The reason why we're not grabbing the funding is because we don't trust anything medical. If it's between life and death, okay, then we have to. Yeah, we'll touch it. But even when someone is throwing money literally into our veins, still, there's some kind of attachment. So, even I suppose even with BVL, when we started off, there's lots of people, oh, there's funding for this, there's funding for that. But what happens is with these funding avenues, this is my experience. I'm not speaking for everybody. This is just my personal view. I have to say that. There's gatekeepers with this, right? And what they do is, yes, the money is there, which, the Black community in England all put their money in for. But when we try to access that, is really led by white people, to be honest. And you will come with your initiative specific for the Black community, and they will just step in, not knowing how our community works and why it works that way, and telling us, oh, you should try this and try that and try this, and changing it to something else that is really about them having control. Even with BVL, right now, we're trying to find space just for us to do stuff. And I'm finding in the first instance, people are, okay, it's fine. And it's almost if weeks after, there's kind of this change of heart or wanting to change stuff or say that, oh, would you mind just changing it this way? Would you mind changing it that way? Oh, it's not really that. It's just that, and I'm finding I'm hearing the same stories with others. And it just feeds into the whole mistrust. It does. How do you create something that everybody's dying from, an equipment you spend literally billions on, and it's like 40%? It's just, look, the
oximeter machines were developed many, many moons ago.
Not fun.
Not recently, and it's just a question. It's what I met the Secretary of State for Health and Social Care.
They wonder why people why they won't take the vaccine in our community, because you can't even get the machine right. You're supposed to be these doctors and lawyers and bright people, from Oxford and Cambridge and all these fancy dancy places, with this all these letters after your name, and you can't even create a machine to stop killing people. I don't know. That with medical histories, Black community, whoever is, taking on the initiative of, encouraging the Black community to take the vaccine, you don't realize is a combination of not just what's happened in the past, is a combination of what's institutionally happening literally daily now as we speak. There are people who would come to my face and give me their diversity and inclusion speech. Oh, you were great, we're looking to change this and we're looking to change that and we're bringing in this, and we're working with this black lady and black guy coming in. I'm like, great. You see a brown face, that speech doesn't just belong to me, it belongs to your heart, it belongs to change. It's not just for when you see a brown person walk in and like, oh, better pull the black speech out and say that. Is actually is action. Otherwise it will just keep repeating. It's kind of feeding into it. And to be honest, in my heart of heart, in my personal heart of hearts, as we stand today, I just feel like if people benefit from the system, and this is not just white people, this is black, Asian, whoever, I have experienced that if people are benefiting from the way the system is, they're less likely to challenge it. I've gone to people who are known in this quote unquote swear word, won't say it, acronym. And I've mentioned to them about a certain behavior within their organization, and they've defended it and demonized myself. So then it's like, okay, well, you're asking for me to bring my black voice forward, but you only want it when it actually suits your agenda or it's nice and pretty for you. And I do get it from a lot of the politicians, actually. And I know controversial again, because I like to put it out there, and please disagree, it's out there, that's what it's out. It's about having conversation, right? But I do feel there is a push on it's always the Conservatives, and it's not. I thought this when I started BVL. Everyone told me that my quote unquote enemy was going to be the Conservative Party and the white male. And yes, okay, I get it. There is stuff there. We all know it. It's out in the open. However, I've had more of the things that people warned me about from the other parties, I should say, than who they were. And I've had more quote unquote help from the white males, and statistically speaking with BVL so far, whether what is motivated by, I don't know, but I just feel like this. Oh gosh, with Sonia's contribution just now, it just brought out a lot in me. It touched on a lot, and it touched on a lot to what Clive was bringing forward with the Afrophobia. It just feeds into it all, and it just makes all the good job that Priya and Natasha and Mercy are doing. It makes it a lot harder, and I don't think people are getting it. They're not getting it. It's like, I feel like sometimes your job it's a job of a warrior. What Priya, Mercy and Natasha do, it is, because I'm sure sometimes you go into meetings after you've done all this great research and talking to people on the ground, and it's like talking to a brick wall, and I really don't know how you do it.
Mercy, you've got your hands up. Mercy.
I did. Thank you. I completely agree with Michaela. It's something that we face day in, day out, so I'm with you on that one. My question was for Clive. First of all, just to say really thank you. Thank you for sharing your story. It just resonated so much, almost triggering, but I just admired the way you turned such, a situation into something that is of a positive. We're learning out of it and sharing that information and keeping the conversations going. So my question was, some of the people we work with, of course, have, gone through similar experiences as yourselves. And then they are fearful of obviously, saying their story, and then they feel like Michaela just said, they have to sugarcoat, things instead of being as raw as how it felt. What are some of the ways or skills that we can actually slowly get that information out of people and encourage them to just be brave as you've been and actually say your story? you know, because in the world that we're in, I might go and today, what I've heard today, you know, I work for an organization where I can say as it is, but if I was in another organization, they might have perhaps asked me to sugarcoat it and articulate it in a way that's appropriate for commissioners. So how do I encourage community members to just be brave, come forward, say your story as it is?
Well, can you hear me? I believe, you know, we all have to be honest, you know, we have to be brave, regardless of change. If you look at any change, what has ever happened on this planet, people stuck their neck out. You know, it's either that or suffer in silence and, you know, be destroyed. It's a lose-lose situation. If you don't speak out, you're gonna have to internalize it. You know, the worst thing that can happen is, like, I thought that the world would end when I left my job, but I'm doing way better now than I did. And sometimes you have to lose to win. You know, I realize that now. It's a case of, and I would say to you, with regards to people, they are scared, and the fear of the unknown is always a scary thing. But there are good people out there, and I have met them, black, white, Asian, every people. There are people what are more than their job. They are human. They look at their humanity first, you know, so don't be afraid. Although there are a lot of people who are not, but there are a lot. I mean, I reached out to people in the church, never got a response. I reached out to people, you know, of all calibers, and there are people, it doesn't matter who they are. I'll give you an example. You've all probably watched the Terminator or the Matrix film, okay? The lady that wrote that book is called Sophia Stewart, a black lady. You probably were not aware of that. A lot of people are not. When I was going through what I was going through, my mum's neighbor told me that this, and I was like, no, she didn't write this. A black lady didn't write it. And I thought, let me Google it. Googled it, went into YouTube, seen her video, she's speaking. And then it had an email address on the YouTube video. So I emailed her, says, oh, you know, sorry to hear what you're going through. And she'd been basically fighting copyright. They stole her work. She wrote the books, copyrighted them. She was in the movie industry, and they stole her work, the books that she wrote, and they put it out there. Terminator in the 80s and Matrix in the 90s or whatever. And so I emailed her, and I just like said, look, I'm going through what I'm going through, and I can understand completely, you know, the solidarity. And she came back to me. And now this is someone of high importance, you know. And over the years, you know, she spoke to me on Skype, and I've got her in my phone, and, you know, she advised me on my book. With my book, I sent her the draft for her to give me some feedback, yes or no. And she said, it's ready. So I was like, yeah, okay, we you know, and like another thing, what I've done is, when I left UPS and I was at my lowest ebb, I reached out to Nelson Mandela's office, and they came back to me. And they said, Mr. Mandela doesn't work anymore, but we let him know, and he says, keep going. Now, that one bit of advice gave me that energy to, you know, I was at my lowest at that point, you know, almost to the point of just giving up. But this was like, if that person who's gone to jail for 27 years can do this, I'm not in jail, I'm not dead, I'm still breathing. And my mom's got a saying, so where there's life, there's hope. That's what happened. So, you know, people have to, and as a Black community, we have to change our thinking as well of the ancient laws of Ubuntu. Everyone's got to have that community help and be a village and help everyone and support each other. That's why the world's messed up as it is, because through slavery, we've all been put against each other. There's no unity. These are things done on purpose. So there's two things that I do as a Black person, what I've learned from slavery. The two things what they didn't want us to do: reading, learning everything, and unity. So I unify with every Black person, whether they want to engage or not. I make sure I reach out to them, say hello, and make sure I'm available for them. You know, there's no question. People send me information all the time on Facebook and Twitter and stuff. They have over the years an email, and I answer them. And if I can't answer them, I refer them to where they can get the information. So, you know, we've got to stop this. We're on our own here. We're not going to win like that, you know. A lot of people don't understand on the planet, we are not the minority. You know, there's 95 million Black people in Brazil. There's 1 billion Africans. There's, you know, most people are Black and brown on the planet, but they use words like minority and keep your level of intelligence low. So you don't know, but I am curious. So I make sure I know everything. You know, it's like, I want to make a difference on this planet while I'm breathing. So I do what I can. And if we all have that mindset of doing what we can, then we'll be all right. You know, it's like people are scared, but they've got to go, okay, then this is the situation. I've got to expose this. You know, we've all got families, we've all got friends that will help you survive and eat and keep going. Do not afraid, keep going. A lot of my family and friends helped me get through because I was thinking, okay, then can I do this? But you have to leap. It's a leap of faith. And if you have got any faith, you go for it. There's got to be someone that's going to save you regardless. You'd be surprised where your help's going to come from. So I say to you, if you've got people like that, let them speak out. If they don't want to speak, let them pass it to someone who will speak on their behalf, but just make sure they have the things in place and let them talk about it. Get it out in the open, let people know what you're going through, because we have suicidal rates through the roof with Black people.
And from children, Clive, from children.
Yeah, so I mean,
I used to work for mines. Tell me about it.
Yeah, a friend a couple of years ago killed himself, and there's lots of suicide, you know, in the Black community especially. It's crazy, and that's because they're scared to speak, and we've got to let people speak.
Frightened.
Yeah. So
just on that note, I just wanted to just quickly, I mean, she is coming next month to speak. I just want to bring in just introduce Ruhinda from Purple Cloud Therapy. She's just listening tonight, but she will be obviously working with BVL, working with Priya and Natasha on the what have you labeled them? The meetings, the follow-up meetings.
The ones before
the meet
and greet ones.
Yes. Just basically, we're looking to work with Ruhinda from Purple Cloud Therapy on supporting the Black community on mental health, and she's been amazing at advising BVL. Her platform is primarily working with different communities. But obviously we're specific communities, so we'll be working obviously with the Black community, but her services, she does support different and has experience working with different communities of different cultures. So but we'll hear more from Ruhinda next month, but it's great to have you here, Ruhinda, so thank you. I just wanted to ask,
can I just quickly ask, Ruhinda's work, is it also with young children?
She does. Yeah, I'll let her speak.
Like teenagers. I'm only asking because at the moment that's such a hot topic for us, you know.
Yeah, hi, sorry. Apologies first for joining in late. Wasn't planned this way. But yes, I do work with young people as well, so adults and young people. I'm working a lot around mental health. Working closely with BVL. Try and work local and connect with the communities that are connected with BVL as well.
Well, thank you.
Could I just quickly ask Clive, with Afrophobia, what would you say to someone who says that Afrophobia doesn't exist? How would you?
Well, there's so many examples. I mean, you just refer them to the George Floyds of this world. You know, there's people. It's so common. Look at the Windrush scandal. You know, there's so many things to point them to. It exists. It exists because there's this factual information on it. You know,
but what if they label that as now I'm only saying this because I've had conversations with people at my church, funny enough.
Wow.
And from my own community, even more strange. Afrophobia doesn't exist. that could have been someone making a mistake, someone having a bad day. And that was a really bad day for George Floyd. But anyway, yes. How do you respond? I mean, what is the response? I don't know.
Well, they've obviously not experienced anything like that. There are people that do not experience that. Or another thing, they might turn a blind eye and think it's normal. Yeah. So what's normal to them is not always normal to a person like myself, you know, and a person like yourself. So yeah, some people will accept it. This is normal. You know, they think that Black people, it's historically happened to Black people. So why should I complain? You know, so that just, I would say that would be my response. I'd say, well, if you've never experienced it, that is your norm, but that is not the norm of reality. That should not happen. If we've got equal rights and everyone's treated fairly, then that should not happen. But you've got a lot of examples to highlight what I'm saying, which is factual, you know, and point them to that. But that is their norm, that they think, oh no, I'm not, you know, I'm not meant to say anything. You know, you do get people like that. I know exactly what you say. And like, especially like in the church, for example, shocking what you just said. I mean, in these times, but I know from my experience, I reached out to the church, you know, and it's in the book. They were the first people I thought, people of God, I'm a person of God, I would be on that, you know what I mean? But I open my eyes, and experience teaches you more than anything. Theory is one thing, experience, you're going to find out the truth.
Well, when I started BVL, I went to my church first because that's my first go-to.
Yeah.
Door shut, bam, in the face.
Yeah.
Straight away. And I just, you know, I'm a spiritual person. So God led me where it leads me. I go completely, it's completely by faith. And I take where he leads me, and look at this here. Got Healthwatch, Hertfordshire. I have to say, I'm just so impressed by Priya and Tasha. I really am. Everywhere I go, because I just think they've just done some amazing work. Do you know what? They came along and I literally, you know, went on my rants, and they were like, yeah. And I thought, they ain't going to come back with nothing. They're going to stick with, you know, and they literally listened.
Well, that's an example. That's an example of what I'm talking about.
Yes,
you'd be surprised
and that's the hope. That's the hope, because, you know, I've expressed my opinion about anything health. So already they're called Healthwatch, and already, you know, the gates are up, right? But it's people like you guys that like, oh, okay, so nice people do exist in like health stuff. So okay, well, yeah, maybe there is hope.
I was gonna your question though, Michaela, was a question that I was thinking of asking myself, because I was just thinking, is Tasha still there? She dropped off.
No, I'm here.
Yeah. Oh, you're there. And yeah, I was just because I was just thinking, Tasha, about some of the responses that we've had from Black communities and Asian communities. So we've got examples across both, where people have responded either to the survey or within focus groups, and sometimes the response is around, you know, that they live beyond race. Like, you know, it's about you know, race and ethnicity doesn't matter, because it's important to kind of live beyond that, and so therefore they think that work like this doesn't really help that cause, and actually is sort of causing kind of more division.
Yes, I get that a lot in my church. Oh, it's a bit divisive, isn't it?
Yeah, which has just been really interesting. I mean, like you said, we know that these arguments exist, but it's just really interesting that that they're so like alive now, when you feel that there's more of a consensus around these issues. So that's been really interesting, and there's been a few sort of comments like that through the survey, hasn't there, Tasha, as well?
Yeah, and I think as well, it's why when me and Priya were speaking earlier, we were kind of trying to stress that it doesn't matter whether someone's had like a positive or a negative experience, or even maybe just like a very neutral experience, but it's by having conversations that hopefully people might realise, if they have, not hoping that they have experienced it, hoping that if they have, they can kind of recognise it and use it to kind of drive change in the future.
And I also wanted to just stress, if anyone out there holds a completely different opinion to my own and does think that even BVL space, or what we're talking about today, is divisive, and your opinion matters and it belongs in the space. So just every voice matters, and don't think just because you're not hearing your voice today that your voice is not welcome or doesn't matter. It belongs in the space and it should be heard. The same way that our voice, completely different to yours, deserves a space at the table and should be heard as well. So I just wanted to put that out there.
This is a comment that I need you all to be aware of. I need to get out more, get a life. I was watching a program called Death in Paradise, okay, set in some fictional Caribbean island, and I thought it was pants. But on this program, this particular program, it had a character called Mama Water, okay. And I thought, wow, who is Mammy Water, you're going to say?
Is not Mammy, is Mammy Water.
Okay, Mammy Water.
Mammy Water.
But wherever you are in the Afro-Caribbean diaspora, she has different names, but she is the same person. She's a mermaid. She's good and she's bad. She has sparkly tail. She has long hair. She has curly hair. She has eyes like marble. But do you know what? Mammy Water is good. And on this program, it was talking about Mammy Water. And it took me back to my time as a child with my godmother and my aunt. Because that's how on a Sunday or on a family day, we would spend our time telling folklore stories about Mammy Water or Anansi the spider.
Sukunya.
Yeah, and Anansi the spider. And of course, I was watching this program. I didn't think it was authentic, but of course it is, because there it was. They were saying that this boat was going to go and see Mammy Water. And for those of you who don't know who Mammy Water is, first of all, shame on you. Mammy Water is the spirit guide who looked after our menfolk who went fishing. And who is she? The Black Ariel before Disney
made her white and red hair.
Yeah.
Nothing wrong with her being white and having red hair, actually. Ariel's beautiful. It's just just stick to it. As all of a sudden Confucius is from Africa. No, Confucius is from Asia. If you did a film, stick to understand the assignment, people. Understand the assignment.
We're all talking about mental health. That is one of the things I do with my young children. I bring them characters like Mammy Water and Nancy the Spider, and I encourage play. The children make a Nancy the Spider because a Nancy is naughty. Okay, we had to put a Nancy on the naughty step because he can't be carrying on like that. But of course, there we have Mammy Water. Is she good or is she bad? Hey, it doesn't matter. But that's what I teach those young children, to love themselves. And I say you've got to live your life. You've got to love yourself. And laughter is the best medicine. Thank you all.
And Mercy, I had a question for you, if I may. Well, I had 6, but I'll pick one. Oh my God, terrible. Okay, so who funds CDA?
Oh, good question.
Okay.
I actually don't know, Michaela. I just know who funds the project I work on.
Okay. Would you be able to find out and let us know?
Definitely, I will be able to find out. Yeah.
The only reason why I ask, and you guys probably already know, which is why I think I personally feel that element with Healthwatch Hertfordshire's worked really well. The Black community we don't trust nothing. We don't trust nothing, even within our own community. And
I always tell people, until I've seen something, I have to touch, feel in just everyday life. Then I'm like, okay, it's real. So
it's real,
yes,
absolutely, yes. And if my friend doesn't die from it, you try it first. Okay, if you don't, then I'll try it. but the reason why I ask is because with everything community and anything for, you know, whatever we're offering, the Black community, one question that does come up is who's funding it? Oh, is it council? Oh no, not touching it.
Exactly, because we are so because
Yeah.
I completely agree. Yeah. I
Yes.
don't know who funds that one, but I'll find out.
Yeah, I know. With we run a free dance class on the weekends, which eventually, you know, we will get to a point where we're generating funds to fund it, but it's being funded by myself as my overflow of heart to community. But I found that I've got a more what do you call settlement of heart with parents that are considering coming along once they find out that it's me that's doing it. If I even mention the C word or the G word, i.e. council or government, they're like, oh, some people are fine with it. Some people are not, you know, generally people who work within that sector, government, etc. They're not fussed. But generally,
I completely agree, because even with the project we do, if we're doing any leaflets, we take away all the government logos, all the local authority logos, because, you know, we associated with them being a part of that whole, you know, picture, the governments, and I completely agree.
Yeah, so it's just something to kind of we already were aware of it, obviously, but yeah, it's just something to kind of to think about and note. And if there's anything we can do to help you guys with the whole B swear word acronym, let us know.
It's a battle, you know, it's a battle where you've got the staff members completely, you know, not resonating with it, we're not agreeing with it, but it's obviously our hands are tied.
The superiors of CDA, are they all white? Okay, so CDA, is it primarily was it something, an organization that was created for a majority white community, and then they thought, oh, okay, Black people need help too, so
I think to start off, historically, I think it was created for that purpose, and they were just working with the rural, you know, rural communities and rural people. And as we know, without being stereotypical, a lot of the, you know, our white counterparts are living in those areas. But I think they've done quite a few of different projects. You know, they've been commissioned to do different projects. So then they won this particular CRB, and it's actually the only project that they're doing that's to do with Black people or Asian people. All the other projects are nothing to do with that. So, but I think they have a certain influence in the community, but I don't know if it's an influence that cuts across through the Black and Asian community as well as the, you know, white counterparts.
So why haven't they given you a position on the ruling board?
Good question.
I would like to put that to them. You need people. If you can't make decisions for people you have no idea about, and that's across the board on the human spectrum. You can't rule a people you have no idea about. Having a Black friend or having an Asian friend or whoever is your friend, or, you know, you have a son that's Black or a daughter that's Black, it isn't the same. It is, you need to have people who understand the journey you're trying to aid. So get those people on your boards. That's my contribution.
Great. No, it is great feedback, and I'll definitely take it back. So thank you.
Yeah.
Right.
Mercy for leadership. Thank you.
The mercy for the community for now.
Community, yes, for the community.
Well, people, it's that witching time coming up. I'm going to do a round robin. Clive, do you want to say a final word?
Yes, I'd like to thank everyone on the panel. Thanks for your contribution. And do you know, regarding Priya and Tasha and Mercy, do you want me to share any of your links on like my social media or anything like that? Just let us know. Because like I like to share things for people. You know, people have asked me before, and I've, you know, I say, yeah, just post it on my wall or whatever. But, you know, you need to, you know, expand drop my mouse, and get things out there. Don't be shy. Just get whatever you need from the community. They are there messing about on Facebook doing nothing. So yeah, I mean, it's been great listening to all the information, and I'm always trying to help where I can. Like I said, we've got to be part of the community to help the community. So this is my way of living.
Okay, Michaela, do you want to say anything?
Thank you all. You've been absolutely brilliant. Please come back. Please keep us updated, because we don't want you just to come and, just contribute for the one. Anything you're doing, please come. This is the platform for you. So come and share and celebrate. And I look forward to hearing from Ruhina next month. And have a great evening, everyone.
Okay, Mercy, do you want to say anything?
No, just to say it was really such a brilliant, inspiring evening. I thoroughly enjoyed it, and perhaps just to say it is hard, the work we're doing. It sometimes is very disheartening, but just keep going. Persevere through it, be consistent, and just keep going. And eventually, one day, you'll just hit a nerve or connect. And then all the other work you've been doing will definitely add up to it. And I definitely look forward to Ruhina's talk or presentation for next month. So count me in. Thank you.
Tasha, would you like to say something? Your final closing words?
Just to echo what everyone else has said, really, just a big thank you, obviously, to Michaela for inviting us and everyone else for listening. And yeah, I just think this is a really important space, and I personally find it really valuable to have the opportunity to just listen to people speak about their experiences and things. So yeah, looking forward to the next one.
Hi, Ruhina. I know you weren't here as just an observer. Would you like to say anything today?
Yeah, I feel a little bit gutted. I feel like it was a fruitful session that I really missed, and I'm really, I feel like I missed out today. And I'm, really sorry as well. I was looking forward to it, but it didn't go as planned. But I can see, from the tail end of what I caught, that, the community coming together and, building strong networks. And I feel like, what Clive was saying and echoing a bit of that as well. It is important for us to be able to support one another in the work that we're doing, and celebrate it, and get it out there. Consistency and hard work will definitely pay off. I have my own passion, as Michaela and Priya and Tasha know, from our last meeting as well, that working in mental health and other areas and other fields and in the community, it is a really driving force. And I am looking forward to next month in our, on our talk. So hopefully you will join us in that. And if there's any questions or anything else in the meantime, feel free to take my contact details to ask me anything.
One and only Sam, do you want to say anything? You're on mute, Sam.
Sorry about that. I'm going to use two sort of statements. The first one is that Yoruba people will say, that's Yoruba from Nigeria, they will say that when you have your two hands and your left hand washes the right and the right washes the left, then your two hands become clean. If I'm just doing that, nothing is really washing the back of my hand, okay? But if I do that, then the two hands becomes clean. And it's really great to see community coming together on a new platform, sort of creating a new thing, which leads to my second word. And that is, when we look at it, our society is broken. Okay? It's broken because of selfishness, because some people feel that they are better or richer And as such, they do not see other person as being part of, which is what racism is all about. So it's broken. And what we are doing tonight is like we are potters, and we are now taking the clay and sort of grinding them bit by bit by bit. It takes long, but we are grinding it. And the more we grind it, then the more it's going to become more pliable. Okay?
Right. Priya, would you like to say something?
Well, I think what you were just saying, Stan, was incredibly beautiful, and I think that's exactly what I was thinking. I was just thinking it's so refreshing and just so uplifting to come to a space like this and somewhere like this where we're all trying to achieve the same thing. We're all, we're all trying to do the same. We're all trying to bring about some kind of change. And as Mercy says, when you're working on it alone, it can feel frustrating and it can be tough. But when you come into a sort of space like this and you're hearing what everyone else is trying to do and that we're all trying to move forward together, you can't help but, I think, walk away with feeling a little bit better about things. So yeah, so I just think huge thank you to everyone. And can I just do a quick thank you to Mercy, because not Mercy, sorry, Michaela. Mercy too, but Michaela in particular, because Michaela, you're definitely one of those people that whatever meeting we go into together, you're there to uplift. You're there to sort of, have that kind of positivity. And me and Tasha always say, whenever we leave a meeting with you, we're ready to take it on, just so that we can report back to you when we finally achieve something. So yeah, so thank you for this group, and thanks for having us again.
Jennifer, would you like to say something? Okay, right, and Jennifer, I can't hear.
Might be asleep.
Yeah. Thank you all for attending, and special thanks to all our guest speakers and monitors. Black Voice Hertfordshire community meeting strongly encourages a solution, action, productivity on issues raised. So if you've been delegated a task, please action. The minutes and recordings of this meeting will be sent to you, provided we have your email. So please ensure we have your email addresses. We look forward to seeing you at the next meeting, which is going to be in March. Please enjoy the rest of your evening. Take care. Goodbye. Au revoir.
Au revoir. Thank you. Good night, everybody.
Bye.
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 Bye.